A winter virus surge across the country and here in Wisconsin. According to the Centers for Disease Control and Prevention, their numbers show Wisconsin with the third highest number of whooping cough cases, 2,474. That's behind Pennsylvania and New York only. State health officials say 70 counties have had at least one case of whooping cough since January 1st of last year. Dr. Minhaj Hussain specializes in infectious diseases for Aurora Healthcare. Dr. Hussain, good to have you here with us. I want to talk about three specific things: whooping cough, flu, and norovirus. It is that time of year, winter. We're in the early part of the year in January. Is this surge of cases that we're seeing of all three of those unexpected, or is there something driving these?
It is a little bit unexpected. We are seeing a lot more than we normally see in previous years. We did have a lot of masking and COVID precautions for the last several years, so maybe that was driving the cases down. But it is definitely unexpected. I'm not exactly sure what's driving it, but it is definitely concerning.
We put up some numbers. We showed there Wisconsin, the third most cases of whooping cough behind Pennsylvania and New York. And we know kids are magnets for germs. Half of those numbers, half of the cases of whooping cough are in individuals aged 11 to 18.
So kids, like you said best, they go to schools, daycares. They may or may not share their toys, but they definitely share their germs. So yes, we are seeing a lot of cases of whooping cough. The best defense is hand hygiene, vaccinations, and things like that. But we are seeing a lot.
And I know, Aurora, we mentioned implemented a mask mandate. Talk about the importance of masking when we're seeing surges like these.
So masking was very helpful in containing COVID to a good extent. We would have had a lot more cases if we hadn't done that. And the masking mandates and things are a good way of reminding people that these viruses can surge at any given time, especially the flu. Before COVID was popular, so to speak, we had the flu. And the flu was responsible for several deaths throughout the country. And so masking will be very, very beneficial to contain the rate at which the flu is spreading, as well as whooping cough.
And you mentioned flu. CDC map that I believe we just had there, if we can pull that back up, showing the majority of the country has moderate to very high flu rates. And I know doctors often promote the importance of getting a flu vaccine as well.
So flu vaccines have been around for several decades. They're very effective. They can either prevent the illness, or if they don't necessarily prevent every illness, they can at least reduce the severity. So we highly do recommend everybody to get the flu shot. If you haven't done it already, it's not too late. You can still get the flu shot. It's easy, it takes a minute, and it is very safe.
And finally, norovirus cases, weekly cases, tripled since Thanksgiving and are at their highest rate since 2021.
Yes, they are. Also very concerning. So flu, COVID, whooping cough, these are respiratory illnesses, but norovirus is more of a stomach bug. So a lot of times we hear somebody has a stomach flu. That could very well be norovirus. It's also transmitted through in young people, like we talked about earlier, and in elder populations. A lot of the cases we see are in long-term facilities with elder and nursing homes, and it's very, very contagious. The symptoms include nausea, vomiting, diarrhea, and so we're seeing a lot of cases come in with dehydration in elder folks because they can't keep up with their fluid intake. The best prevention is hand hygiene. Hand hygiene for norovirus is the equivalent of a mask for flu. Fresh produce, fruits and vegetables, wash it under running water very well for several minutes. And these are the ways we can hopefully prevent it.
And on the opposite side of prevention, let's say you do come down with one of these. Let's talk about treatment for flu, norovirus, whooping cough.
So there are no specific treatments for most of these viral illnesses. The best treatment is supportive measures, stay hydrated, try to isolate if possible, and just general precautions are the most important thing. That's how we overcome it. Most people will recover in about 2 to 3 days. If they're children or elderly or immunocompromised, they may take a little longer.
All right, Dr. Minhaj Hussain from Aurora Healthcare, thank you so much.
My pleasure.